Well, it's a big question. I'm not sure of the details of what's happened to you, but I would say obviously if you have a scarring in your uterus, that's called Asherman syndrome. And with the Asherman syndrome, there's a possibility through a hysteroscope to cut all the scars, put you on estrogen, and get the endometrial lining to cover up those scars so that you could actually have a successful implantation. It's called Asherman syndrome. You do hysteroscopic resection to try to get rid of that scar inside. I don't know exactly how you got scarred or what this bad advice was from this infertility doctor. I don't know. But for sure, you need a hysteroscopy to evaluate if there really is any scarring. And if there is, to try to lyse that scar and put you on estrogen. We can evaluate the quality of the uterine lining, believe it or not, better with ultrasound than with either MRI or hysteroscopy. Hysteroscopy, we can see the scar tissue, but whether or not the remaining uterine lining is going to be receptive is really best evaluated with ultrasound. And we look for a perfect, we don't care about the thickness. Many people do, but we don't think the thickness is that important. What's important for uterine lining is a proper structure with a good triple layer. We can evaluate that best on ultrasound. Uh, so if the lysis of adhesions with hysteroscopy doesn't result in a normal uterus without any intrauterine scarring, then the options are uterine transplant or gestational surrogate. Now, in the United States, gestational surrogacy would be the right way to go if your uterus is non-repairable, because it really works and it's legal, and there are plenty of women that are willing, in fact, want to carry a baby, but they've already had children and they love being pregnant, but they don't want to keep the baby. And the law is very clear on this. The intended parent is the parent, so there's no risk that you would be losing the baby because someone else is carrying it. So if the uterus isn't reconstructible, we would not advocate uterine transplant, though we certainly could do it. I was just with Mats Wiklund, who was the first person to do successful uterine transplants in Sweden, and I'm sure he's the most competent person in the world to do uterine transplants. And he's only really had 9 successes, and he's been doing this for 6 years. And so it's a big deal. And I think you only want to do uterine transplant if you're living in a country where gestational surrogacy is illegal and not allowed. Fortunately, in the United States, gestational surrogacy is allowed, and it's really the easiest way to go. It's a sure thing.